I'm Ethan Teshobia. You're watching RwandaTV News live from Kigali. 90% of the 5,000 COVID-19 patients nationwide are under home-based care. However, some of them say they have no access to food rich in nutrients such as fruits, vegetables, milk, meat, and other requirements, which makes them anxious about the chances of recovery. Ghislaine Mugwaneza has this report.
Agasharu is one of the neighborhoods in Gasabo district, where there are 9 households that were tested positive for COVID-19. However, there are places that have got positive cases and still meet others. The Rwanda National Police Deputy Spokesperson, CSP Africa Apollo Sendahangarwa, says that this is punishable by the law.
In Rwanda's Penal Code, Article 117 provides for sanctions against the transmission of disease to others, such as the coronavirus, which has no vaccine or medication, and the sanction is between 20 to 25 years in prison after the court verdict. This is not good, and when you know you are infected and there are symptoms of the illness like the coronavirus which kills and you're spreading it, it is a punishable offense.
The patients that are treated at home have said that doctors told them that in order to be cured, they should eat vegetables, fruits, meats and drink milk. However, adding that they could not afford because they had to work to provide for their livelihoods. I went for the test and it was positive for COVID-19, and it was necessary that we be placed in isolation at home, and then the means are modest, when we were given only beans and maize flour, while I have young children. For example, this one needs porridge, milk and other things, and I need these fruits too, and we really don't have anything at home except the beans and corn meals we were given. In fact, I would sit here with a bucket, and if someone buys charcoal for 500, I would buy myself fruits, and I would find carrots in the field and other things that can help me. I can't afford it. They just gave us maize flour. Pidas Ruwingisa Kigali City Mayor has said that those that are under treatment should stay at home, and those that have food problem would be helped at home.
Those who need supplements on what we can find, especially those households with children, we give them milk. COVID-19 patients who are at home and who do not have to go out for groceries, following the lockdown measures, whoever is sick should stay home for at least 10 days and will have other tests to assess their condition. Anyone who is facing the problem of food, he calls the number, but this is not necessary because there are in particular health auxiliaries who work with the village chiefs to visit them and see if they have enough to eat. And those in need find help in this way. They are not only looking at the diet, but also the patient's progress, but they first visit them and see if they are poor or if they cannot get out to find groceries.
Epidemic Surveillance Response Division Manager at Rwanda Biomedical Center, Dr. Rwagasore Edson, has said that in order to follow and treat those that are at their homes, their names are well known by those that treat them.
It is true that it is worrying when there are sick people who walk around and spread the virus, and therefore we are seeing the right way to do it by collaborating with groups at village level made up of local authorities and health center officials. We continue to publish the names, but in a safe way, because we have confidence in this group, for we do not want there to be errors or disclosure of patients' secrets.
Since the start of treating COVID-19 patients at home, 4,000 patients are followed, whether at home, as indicated by RBC.
The Ministry of Health has come out to criticize some Kigali people who violated COVID-19 prevention guidelines. Those in question are football fans who poured onto the streets of Kigali on Tuesday night to celebrate the victory of the national football team Amavubi against Togo in the ongoing Total African Nations Championship, CHAN. The Minister of State in the Ministry of Health, Dr. Muga Tarsis, said the behavior was alarming as it could be the root cause of the spread of COVID-19 pandemic in Rwanda. Here is what he had to say. People taking onto the streets is a major concern to the health sector because there could be carriers of COVID-19 virus, leading to an increase in the spread of the pandemic, an increase in the number of patients, and an increase to the number of deaths. This is seen as disrespect to the set health guidelines. The football game they were celebrating was not played in the country. It was in Cameroon, and it was being shown live on TV. There was no public screening. So pouring out onto the streets without protection, now I think it is a serious disregard of COVID-19 prevention measures, which is what we've often seen throughout the year that we have been fighting this pandemic. People don't respect the measures that have been taken, yet the guidelines are put in place to keep all of us safe. The embassies of Israel and Germany in Rwanda, together with the Office of the United Nations Resident Coordinator, held a virtual commemoration in honor of the victims of the Holocaust this Wednesday in Kigali. The event was officiated by Justice Minister Johnston Busingye, who doubles as the Attorney General of the government of Rwanda. The virtual International Day of Commemoration in memory of the victims of Holocaust in Kigali was also attended by Ron Adam, the ambassador of the State of Israel to Rwanda, Dr. Thomas Kutz, the ambassador of the Federal Republic of Germany, and the UN resident coordinator for Rwanda, Dr. Ford Ndiaye, His Eminence, the Cardinal Antoine Kambanda, and Professor Dina Porat, chief historian of the Yad Hashem, were also in attendance. Further elements of the ceremony included a video screening of the Elie Wiesel, a recipient of the Nobel Peace Prize, who was 15 when the Nazis deported him along with his family from their home in Pennsylvania to Auschwitz. The Holocaust, which happened between 1940 and 1945, was the systematic state-sponsored killing of at least 6 million Jewish men, women, and children, and millions of others by Nazi Germany and its collaborators. In his remarks, Justice Minister Johnston Busingye noted the Holocaust was as well as genocide against the Tutsi deserve exceptional attention, not only because of the gravity, but also from the point of view of their historic implications. Here is what dignitaries had to say.
Today, it is a great opportunity for me personally and for us all to pause, remind of the history, and commit ourselves to a better future that is peaceful and inclusive. This requires working together, promoting the culture of unity and reconciliation, tolerating existing differences, and living in harmony. I strongly believe that we are created to live the truth, to be the light, and to build a better future. United, we are stronger.
Today, we commemorate the millions of Jewish victims of Nazi German frenzy. We remember and we bow to honor them and their memory. Whole scientific libraries have been written on the German mass murder of the Jews of Europe, the effort to extinguish them, on the Shoah, on the Holocaust. Literature, films, and visual arts have been and still are trying to grasp the events. So we do know and we can remember, but in the end, we are still trying to understand the incomprehensible.
Today, as we commemorate, we share a collective memory of this tragedy of humanity. The magnitude of the Holocaust and the genocide against the Tutsi are forever etched in humanity's collective memory. The Holocaust, as well as the genocide against the Tutsi, deserve exceptional attention, not only because of their gravity, but also from the point of view of their historical significance. The Holocaust happened between 1940 and 1945. Afterwards, the world pledged never again. And the Genocide Convention subsequently was adopted and entered into force in 1948. In spite of this, not too long after the genocide against the Tutsi happened, and the world pledged never again.
As Rwanda and the world continues to cope with COVID-19 pandemic, pharmacists say the efficient use of hand sanitizers to kill viruses is one of the things that can help people cope with the virus. Innocent Mugabo has more.
Habyarimana Flandrier, a pharmacist, says it is important to understand the difference between hand sanitizers and other cleaning detergents because in the event of misuse, the area of use can be damaged. This is the hand sanitizer with an alcohol content of 70% as required by the World Health Organization. It is also made of some glycerin to soften your hands after use, among others. For this is called liquid bleach, and it is used for cleaning surfaces. And the difference between these two is that for the hand sanitizer is made of alcohol, whereas the liquid bleach has no alcohol in it, so it is not advisable to use it on the skin. There are also those that use hand sanitizers to clean surfaces, which is not good since it is flammable, hence not effectively killing the viruses. This liquid bleach is effective in killing viruses due to the fact that it is liquid, therefore it lasts on surfaces. Habyarimana also says that due to the fact that some hand sanitizers look like water depending on the ingredients, people are required to check the quality of the sanitizers they purchase.
Abanyarwanda akanini bakunda kwibaza ikibazo tise imiti sukura intoki.
People always ask themselves about the reasons why some sanitizers are thick and others not. The answer is that there are those that one is required to dilute to the 70% alcohol content as required by the WHO. There is also this one, which is made thick using ethanol, glycerin, and distilled water. So what makes it so thick like this is glycerin, whereby when you use it on your hands, it appears as if you have smeared yourself with Vaseline. People should also always remember to check the expiry date for the effective use.
Ugomba kukwita no kwitariki cyakoreweho ukanareba nibikigize kugira ngo bitazakwangiriza ubuzima.
After years of the government tax cuts on hygiene products used by menstruating women, people say the prices for sanitary products have not dropped but continue to rise day by day. The Ministry of Trade and Industry assures that it is going to conduct a research on the issue.
The government of Rwanda announced on 11th November 2019 that sanitary pads are also added to a list of goods that are value-added tax exempted in order to ease their affordability. This had not happened as it was expected because of the fact that the prices were 500 to 800 francs before, and they increased to 1,000 and above in Kigali city. The last time I went on the market, super sanitary pad was 700, which is 1,000 now. Sanitary pad called Always was 500, but I guess it is 900 now. You understand that prices have changed, and we have no money, especially during this time where people are not working. I used to use super in the beginning of 2020, and the price was 800, but it's now 1,000 or 1,200, depending on the shop. This is also confirmed by Divine Ingabire, the executive director of Imata Initiative that aims to ending period poverty and shame in schools through services, awareness and community. She says that their research shows that there are those that choose to use other simple ways that are unreliable. She asked the government to do follow-up about this problem. Based on what we have seen, girls says that they use handkerchiefs when they do not have those sanitary pads. And those handkerchiefs are not made of cotton, and they're not comfortable for the user when working or in class, and they can cause 2 diseases. What we ask the government is to do follow-up and see why the sellers still have the same price or why they increase them while violating laws. However, industry owners have said that this problem is caused by the shortage of sanitary pads.
The market keeps becoming wider, and I can say it is beyond our capacity. There are more consumers on the market, and you know that when there are more consumers than goods on the market, it is when sellers increase prices. We did not change prices even before, but shortage of sanitary pads on the market could be the reason as to why there are those that want to benefit from it.
birenze babona icyo cyuho.
The Ministry of Trade and Industry has said that the increase in prices for sanitary pads is one of the COVID-19 effects because of the fact that industry owners did not have enough raw materials. They also say that they are going to put more effort in following up this problem.
The follow-up is done, but these days we are emphasizing on food because of the lockdown. But we are going to put more effort to catch those that increase the cost of sanitary pads, and when found guilty, they will be punished.
The sales tax rate in Rwanda stands at 18%, which means that one sanitary pad pack of 10 that cost 1,000 Rwandan francs would be 820 Rwandan francs, which is also a high price in poor families.
In sports, the national football team Amavubi on Tuesday night defeated Togo by 3-2 to progress to quarterfinals of the ongoing Toto African Nations Championship CHAN in Cameroon in 2020. Rwanda finished second in Group C with 5 points, 2 behind defending champions Morocco, in a group that also had Togo and Uganda. It is the second time that Rwanda will be advancing to the knockout stages of CHAN, with the first time being in 2016 on the home soil. During a post-match presser, national team coach Amavubi, Vincent Mashami, made it clear that they are determined to go a step further this time, since the team reached the quarterfinals at home in 2016. Rwanda will face Group D winner that has neighbors Tanzania, Guinea, Namibia, and Zambia.